Are you getting enough exercise? Are you eating right? You know, it's easier said than done. So there's a medical condition that affects a lot of people here in South Texas, and some of the risk factors include being overweight, family history, or not being active enough. And here to tell us more about non-alcoholic fatty liver disease is Clay Dean, Vice President of Clinical Pharmacology Services at Evolution Research Group. Welcome, welcome.
Thanks for having me.
So let's talk about, for folks that may not be familiar with it, what exactly this disease is and how it affects people.
Sure. Fatty liver disease, as the name suggests, is a liver disease that is marked by having more than normal amounts of fat in the liver. And it occurs in people who don't drink excessive amounts of alcohol. So it's driven by lifestyle, sedentary lifestyle, and our diets. The way that it affects people is really interesting because for a long time it doesn't affect people. It doesn't cause symptoms or outward signs. People don't feel badly when they have it.
So they don't know.
They don't.
Yeah.
They don't. It's very easy to ignore because it doesn't cause symptoms or problems until the disease is really advanced, and at that point it can lead to the development of cirrhosis, very much like alcoholic liver disease can. It may require a liver transplant in order to treat the condition, and very often can be fatal.
So what types of people are affected by it, and how many in our area are affected by it?
Yeah, so it's an incredibly common disease. It's an enormous public health concern. In the United States, about 1 in 3 people have fatty liver disease, so that's pretty impressive on its own. But in San Antonio, the number of people affected by it are even higher for a couple of reasons. We have a high incidence of diabetes in the area, and we know that about 70% of people with diabetes have fatty liver disease as well. The two conditions are very related, but it also affects people of Hispanic origin more than it does other ethnicities. So and that's due to genetics, something that we inherit from our parents. There's a particular gene that we've identified that increases the risk of developing fatty liver disease. So, I mean, with no symptoms, I mean, people need to get screened, right? For sure.
And are there screenings for it?
Absolutely. So if you feel like you're at risk for fatty liver disease, if you have any of these underlying risk factors, diabetes, a Hispanic background, even if you want to find out what genes you carry, we can perform that test and let you know if you have the gene that is so implicated in the development of fatty liver disease. And then there's another test that we can run that works very much like an ultrasound. So it's non-invasive, it's not painful, anything like that, but we can do a scan of the liver to find out what type of damage may already be there, and we can assess the risk from those tests.
And because you said, because it can be genetic, it's not, you start getting tested at a later age. It can happen sooner, unfortunately.
Yeah, absolutely. And in the Latino population with that gene, we actually find that they encounter the disease at an earlier age than other groups, and even at normal body weights, where we would ordinarily expect it to be associated with obesity. So that genetic component is hugely important, and especially for this area.
All right, let's get the information up on the screen. To book your free screening for non-alcoholic fatty liver disease, just call 210-879-3880. And for more information, visit their website, endeavorct.com.